My name is Dr. Ram Narula. I'm the Director of Trauma Services at University of Utah Healthcare. We've created this trauma systems training video to be a resource to EMS and other healthcare workers on how initial trauma care is done at our Level 1 Trauma Center. It's our goal to provide seamless care as patients transition from pre-hospital EMS to the emergency department.
Auto accident, the white motorcycle versus a gray Sebring.
University, we're around your facility. Single motorcycle, clock control, no helmet.
The University of Utah was the first Level 1 trauma center to be certified by the American College of Surgeons in the state of Utah. We admit more than 2,000 trauma patients per year and have a dedicated trauma surgeon and trauma response team in the hospital 24/7 to care for the injured patients and their families. Trauma care begins at the scene.
Hey Rob, we're almost there, okay? Hang in there.
With arrival of EMS personnel. To ensure appropriate deployment of resources within the hospital, we have developed specific criteria for trauma activation. There are 3 levels of trauma activation. This activation criteria is based on vital sign assessment, obvious injury, mechanism of injury, and special considerations such as use of anticoagulants or extremes in age. A Level 1 activation indicates life-threatening injury. A Level 1 activation will summon providers from trauma surgery, emergency medicine, anesthesia, orthopedics, neurosurgery, pharmacy, respiratory therapy, and social work to the ED. Additional blood is brought to the trauma bay, and the OR puts an operating room on hold in the event the patient requires immediate surgical care.
1029, go ahead, AirMed.
Combative, we electively intubated him.
During radio contact, it's important to quickly convey pertinent information about the patient and their injury, including the mechanism involved, vital signs, treatment given, and ETA. Before the patient arrives, the team conducts a trauma timeout, an important step in which the trauma team leader identifies team members and their roles, with assignments for specific procedures that might be required.
So if we need a chest tube on the right side, I'm going to have you do that, and you'll be responsible for the fast exam after the primary survey.
At this time, the team leader will share any updated information and details about the patient's mechanism, vital signs, interventions, and identified injuries. Necessary equipment for prospective procedures is made available. For all Trauma 1 activations, a chest tube tray and MAC lines are to be placed on either side of the trauma bay so that they are readily available. The rapid fluid infuser is primed for use. The team members are in the room and their positions are: the trauma team leader is positioned at the foot of the bed. This is the person in charge and to whom you will give report. The airway provider is at the head of the bed. This person is responsible for assessing the airway and establishing an airway as needed. They are also responsible for assessing the GCS and performing the head exam. Examiner 1, at the patient's right, is responsible for the initial airway, breathing, and circulatory assessment, and performs the fast ultrasound exam of the abdomen to assess for internal hemorrhage. Examiner 2, at the patient's left, assists in exposing the patient and performs the secondary survey. The trauma nurse, at the patient's left, obtains the first manual blood pressure upon arrival, places monitors, and assists with IV access. The trauma scribe, behind the team leader, records events, orders, physical findings, and patient response to treatment. Other people in the room will be the trauma EMT, a lab tech, and a pharmacist. This is the core group of providers who will be in the same role each time for every trauma patient. When the patient arrives in the trauma bay, team members are already positioned, have completed their timeout, and prepared to begin the trauma resuscitation based on current ATLS guidelines.
Trauma 1 has arrived.
Trauma arrival is announced over the overhead, and the room should be quiet and free of distraction for the subsequent steps. During the time the patient is undergoing the primary assessment, the EMS personnel can give a brief summary to the ED attending of interventions performed since their last communication. They can also supply any images on disk if the patient came from another hospital so that they can be uploaded.
Ready to move? 1, 2, 3.
The patient is brought over to the trauma bed from the stretcher where Examiner 1 will perform the initial assessment of the airway, breathing, and circulation. If life-threatening emergencies are identified during this assessment, treatment is initiated immediately. The trauma nurse gets an initial manual blood pressure reading, which is called out to the trauma team.
80/50.
After life-saving maneuvers are initiated, a report is then provided by EMS. The trauma leader will request a formal report that's given to the trauma team by the EMS.
Okay, let's go ahead and get a report.
This is a 37-year-old male who was involved in a motorcycle crash, no helmet.
Our newly developed EMS report template can be used as a guide. As report is taken, several processes of patient assessment begin to occur. IV access is confirmed and possibly new peripheral access is established. The patient is exposed so that injuries can be identified and assessments can be made. FAST exam is performed. Examiner 1 begins the FAST exam. Pelvis is assessed for fracture and gross extremity deformities are noted. Peripheral pulses are checked in all extremities. Examiner 2 begins to perform the secondary survey with assessment of anterior chest, abdomen, and pelvis, as well as extremities.
Okay, 1, 2, 3.
Once these steps are complete, the patient is rolled to access posterior surfaces and palpate spine, and the spine board is removed. It is our goal to have a defined plan for the trauma patient in less than 15 minutes. Decisions must be made to go to the CT scanner, the operating room, the ICU, or the ED observation unit.
We hope this training has given you a sense of the trauma evaluation at the University of Utah Trauma Center, and that it will allow you to develop a familiarity with the process, what's expected in the trauma bay, and your role within the patient care process. Our goal is to provide the highest quality patient care in the most efficient way. We look forward to working with you to achieve that goal.